Columbus, Ohio. And we're going to talk for a minute on this video about deep teeth cleaning, or otherwise known as scaling and root cleaning. If you have heard those words lately and you're looking for information, that means that you have been diagnosed either by myself or someone else, but having some form of issue or some level of a gum disease, at least someplace in your mouth. Gum disease is the most common disease on the planet. It is universally on all continents and all peoples. 8 out of 10 people have some form of gum disease. 4 out of those 8 have a more serious form. And those are the ones that are going to hear those words, deep cleaning. If it's left untreated, it will continue to get worse, it will continue to spread, and the result is that it tends to eat up the bones and the tissue around your teeth, and your teeth will fall out. It will take it a while to do this, but it is pretty much that's what's going to happen. So, we want to try and stop that process from happening. A regular cleaning is essentially treats everything from the gum up. That's a preventative measure. That means you don't have gum disease, we don't have to get down into there, that sort of thing. Deep cleaning means you have developed a problem. The gum now has, and bone around that tooth now has an infection in at least one spot or maybe more. And we now have to go try and get down inside there and clean these areas out. The little bacteria that like to live in your mouth, there are 450 different kinds. Population, 4.5 billion of these little guys living in your mouth that you can't see. I think that's kind of gross and disgusting, personally. They cause a lot of damage inside these areas, and essentially the teeth and the bones get eroded. Now, you can brush, you can floss. Once those bacteria erode that tissue down far enough, you can't reach it with a brush, you can't reach it with a floss. You can sometimes reach it with what's called a hydroflosser, which is a water pick type device that we like to use. And some medicines that we use will reach down in there. But it's going to take your hygienist to reach down inside there with her instruments and get that area all cleaned out. And sometimes if that infection is down in there, and if you have it in a large number of places, we're going to put you on an antibiotic. Probably 2 of them for about a week. If it's just 1 or 2 spots, we may take a smaller antibiotic and put it directly into that space. The one we like to use is generally called Arrestin. It's kind of a yellow powder that fits in there. We're going to ask you to do extra things at home, because what this basically means is you're going to need to do a little more work. We have to do more work when you come to see us, and you're going to have to do some more at home as far as the maintenance goes, as far as brushing, flossing, and that sort of thing, and you're almost going to have to get almost religious about this in order to make this happen. Now, when we're going to get all of these areas cleaned out, we're still not going to be able to get rid of 100% of these bacteria. There's going to be some left. They're going to kind of try and grow back. And they usually takes them about 3 months to start to get organized and really start to growing back again. That's why we really and truly want to stress to you that you have to make those 3-month visits, and that's why we recommend them. Not because we want to see you more often, not because we're going to charge you a lot more money. It's because we want to see you to stop those bacteria from growing. Because if they take over again, you're back to square one, and we've got to start all over again. So at that 3-month period, we want to get back down in there, disorganize these bugs' life, make these little bugs, area and environment just as miserable as possible for them, so that they just can't grow very well. Now, that's the whole process of deep cleaning. Get down inside, remove the bugs, apply some antibiotics to help cure things, and help make you as healthy as possible so you can keep your teeth as long as possible. Now, you're going to ask 2 final points on this. No, you really don't. You don't have to do this if you don't want to. If you don't, the infection will spread. You will lose bone, you will lose tissue, you will lose some of your teeth. So you don't have to do this, just around the ones you want to keep. Thank you.